Listen to the dialogue. Mr. Brown had an operation 2 days ago to reduce his fracture. He is in the orthopedic ward. The surgeon has cut a window in the plaster to dress his wound. Mr. Brown's wound is purulent. His dressings are changed twice a day. Sally, a student nurse, is talking to Mr. Brown's nurse. She is going to change his dressing.
Sally, let's go through the procedure together and then you can change Mr. Brown's dressing. So, what do you do first? First, I introduce myself to the patient and then I put on some gloves to prevent any germs getting into the wound. Why? Because this could cause infection. Then I clean the wound with some antiseptic and apply a sterile compress. And what is the drain for? It's to remove the pus. Okay, good. And what happens in the case of infection? Well, we take samples with a sterile cotton swab and send them off to the lab. That's right. When will you remove the drain? I'll remove it little by little when the wound is no longer purulent. If this is the case, then I'll ask the surgeon to have a look first. And what about Mr. Brown's clips? His stitches. I'll remove the stitches in 2 or 3 days. What do you use to remove them? It depends. A stitch cutter, scissors, or we can use a scalpel or a blade. Good. So, Sally, are you ready to change Mr. Brown's dressing? Sure, okay. I'll be with you in case you need my help.
Later with Mr. Brown.
Is your wife coming today, Mr. Brown?
Yes, she is coming this afternoon. She worries a lot, you know. Could you cheer her up a little? She is so anxious.
Of course. I'll talk to her when she arrives.